The reason it's so important to have representation is because it impacts patient care. When we know that based on the color of your skin, the ability to get pain meds, for example, in an emergency room is impacted. Maternal fetal health outcomes are impacted. And one of the strongest antidotes to deal with some of these systemic issues is representation. Having other Black physicians have a seat at the table, to be able to relate and to advocate for Black patients is such an important tool. And it is so important to be able to have people that represent those diverse perspectives, those diverse attitudes.
I believe that it's quite important to have representation, both at the table where decisions are made, but also at the place where you receive your care. Being Black is not a one horse cart. Within the Black lived experience, there is a tremendous variety of places where we come from, experiences culturally, religious, familial, many of which have cross understanding, but not necessarily all of them. But there are so many commonalities in terms of the structures that are in place, that have been used to measure us, to comment on us, to bring bias upon us, that just by being in someone's presence that looks like you, there is this sort of shared understanding that there is going to be some ways and some means to be heard.
The Black physician is, in my opinion, more culturally competent in handling the Black population as compared to any other population out there. And there is something very, very important in the medical field, and that is trust. Because when you get the trust, you get the rapport. When you get the rapport, it's a lot easier for you to communicate and help the patients. And how best to get somebody's trust? If you understand the culture of the person, and with your professional knowledge, you are able to tailor it to the needs of that individual.
Having Black doctors in the healthcare system is really important, considering the fact that we are a diverse multicultural society. The Black people generally lack representation. If a Black patient goes to the hospital or their family doctor is a Black physician, it goes a long way to make the Black patient more comfortable, and the chances of them complying to their treatment is also higher. And this goes a long way to better their health and minimize complications.
It's really important to have representation and having a diversity of physicians, not just around phenotypical racial lines, but also in terms of socioeconomics. We talk often in medicine about the determinants of health, and what really informs your health is the surroundings that you're at. If you do not have an understanding of what your patients go through in terms of trying to stay healthy and trying to access healthcare, there's no way you would know how to program that. Part of having a diversity of physicians within the healthcare force is to inform that. This allows patients to actually have representation and a voice in the healthcare system.